All right, good afternoon and a warm Wayne County welcome to all of you here. Grateful to have the opportunity, really thankful to Dorian and the team here at ESP. I want to start maybe in an unconventional place today. I want to tell you about my grandmother, my Teta Suad. She is the wisest, most intelligent person I have yet to meet in my entire life, but she never got to go to school. She was the 9th of 14, raised in 1940s and 50s Alexandria, Egypt. And I got to know my Teta on summer visits. So any children of immigrants here? So if your parents ever sent you back to the old country, you'd always get the ticket right before school ended, right? Because that was the cheapest ticket. So my parents would ship me off before school ended, and I'd wind up in Alexandria in the one-bedroom apartment where my grandmother and grandfather raised my father and his 5 siblings. But those aren't the only kids to whom my grandmother gave birth. She gave birth to 2 other babies, both of whom died before the age of 1. She had a personal infant mortality rate of 25%. So when I walk in and I have my, American kid swagger, she cut me down to size. This was a woman who didn't take bullshit. I hope that's okay for this audience. And so she'd point to one of my cousins and say, that one's smarter than you. Point to the next one, she's like, I don't have to tell you this, that one's taller and better looking. Third one over there is kinder and softer hearted. That 4th one, more athletic than you. So at some point I'd be like, okay, so what do I have going for me? She said, you get to leave here at the end of the summer. Now, my grandmother's vision of what America was that of the gauzy 1950s that we would send out to places like Egypt. And the crazy thing, and I didn't have the language for it at the time, is that in the 15 hours it would take me to get to Alexandria, Egypt, usually through Schiphol and Amsterdam, I'd travel about 10 years difference in life expectancy. That 10-year difference in life expectancy cost me an aunt and uncle I never got to meet. But I didn't have to go 15 hours from where I grew up. See, I grew up about 45 minutes away from here. That meant that I could go 15 minutes into the outer neighborhoods in the city of Detroit, and I could travel that same 10-year life expectancy gap that I'd have to go 15 hours and cross continents to go to. And to me, that was the reason why I decided to go into medicine, except for I walked into a healthcare system that was more interested in making sure that folks could profit off the bodies of people than we could make sure people on the wrong end of that life expectancy gap had regular access. Now, my grandmother got to visit the United States twice, and the vision of the U.S. that we gave her was one that comported with that 1950s. She could not have imagined that just down the street from where she was visiting, there were kids growing up in circumstances far more similar to the ones that my dad grew up in Egypt than the one that I got to grow up in. Now, why? How do you explain that gap, whether between here and Egypt or here and here? 2 things: racism and poverty. Racism that shows up in the choices we make about who gets to go to a good school, or racism that shows up in who gets the right end of a peace treaty, who gets money, the right end of a negotiated international contract. Colonialism is just international racism. And so my Teta never got to see the other side of racism here. Now, the work that is done on poverty every single day, work that you all do, that is critical work. But we all know that the way that racism kills longest is through poverty. And that is what we're here to talk about today. It's poverty that robs too many black women of access to a doctor. That dictates that when they actually do see their doctor will be reimbursed at half the rate. And so, by definition, before they ever walked in, they were seen as second-class healthcare citizens. It explains the fact that they're 3 to 4 times as likely to die in childbirth. Their babies are 2 to 3 times as likely to die in their infancy. It explains why too many houses in too many communities, just miles from here, have lead laden in the walls. Lead that unfortunately seeps into the skin of children, that poisons their mind before they ever get the chance to start investing in it. It's poverty that dictates that some schools barely get the basic means of being able to dignify those kids' brains, while other schools have everything they possibly could need. It's poverty that dictates why the airshed just 5 minutes from here, is poisoned because of unchecked activity by corporate polluters who'd rather make sure that they invest in that bottom line than they invest in the well-being of our kids. It's poverty that dictates what kind of job you get access to. And it's poverty on the back end of that job that reinstitutes the cycle. So today we're here to talk about guaranteed income. And to me, guaranteed income is that delta, that difference between the vision my teta had of what the United States ought to be and the United States as it is today. And we get a choice as we do that hard work of uprooting racism about whether or not we're willing to meet it where we can on poverty, or we're willing to point at poverty and racism and say, well, these are intractable problems and we've been trying to do something about it. I want to talk to you a little bit about what we in Wayne County are thinking about. And I got to tell you, County Executive Warren C. Evans has led us on a pathway to investing on the various means of being able to address all of these different challenges, the ways that poverty, complicated by racism, intervene under the skin to take away the ability to live a long, dignified, healthy life. One of those things, though, is being able to ask, how do we address poverty at that transition between generations in a family? We've got too many parents trying to do the impossible, to go to school, to raise kids, and to earn a living all at the same time. And so what we'll be proposing in the next several months here in Wayne County is a pilot to invest $500 a month in young parents who are enrolled in community college to try and say, well, look, as you try to do the impossible, we can give you a leg up, one less shift of work a week, to try and be that student you want to be and that parent that you need to be for your kids. So we're very excited to be bringing you that here today, to be pushing that for Wayne County, and we'll look forward to what the results are. But anybody who's ever listened to my podcast or has seen me talk about healthcare knows that I would not be able to leave this stage if I didn't say 3 words: Medicare for all. So I just want to say, crazy thing about my teta's experience, my father's experience, I gotta tell you something. I'm the only brown kid who told his dad that he wanted to be a doctor, and my dad was like, why would you do something silly like that? I'm like, what? That's not what I expected. And I would not really appreciate what his response was until I actually got to interview him for the podcast. See, my dad lost 2 siblings. He told me a story. His first sibling who passed got sick. His mom took her to the hospital, and she never came back. The next time, he was 5. He remembered that story. He couldn't articulate it, but he remembered. And his sibling had had a pretty bad GI illness, and he'd thrown up on a carpet. And then they took him to the hospital, and he never came back. And for 3 days, my dad wouldn't let anybody clean that carpet. It was the last thing he remembered of his brother. And so when I told my dad I wanted to be a doctor, his response was that doctors don't help you. And that was the experience he had in Egypt. But imagine this. In the richest, most powerful country in the world, we do have medicine that can help you. The problem is, the people who need it most don't often get it. So if we're serious about addressing those twin diseases of racism and poverty, one of the most important things we can do is to do what our friend Natalie Foster talks about in her book, to recognize that we need certain guarantees. And income is one of them, but access to high-quality health care should be another. And the way we do that, the way we address that 3-tiered system of citizenship when it comes to health care, is to guarantee that every single person in this country has access to high-quality health care no matter who you are, who your parents are, where you grew up, what you do for work, whether you have work, who you're married to, or if you turn 26. And so I hope that as we leave here today, we all are working on the idea of guaranteed income. And look, it's becoming even more pertinent as we think about an AI future. But let's not forget Medicare for all. Because unless we are working to address the whole of somebody, to ask, what is it that we in this richest, most powerful country in the world ought to be able to guarantee people as a right of being here? I worry that that delta between that vision that my teta had for this place and what it is will persist and maybe grow. But we have a choice about whether or not we do that. All of you all on the right side of not just this history, but that future. And I'm really grateful to be joining you there. Thank you so much.